Greetings to everyone in the community. I'm Dr. Albert Mensah, President and CEO of Mensah Medical. We are a biochemical analysis or assessment model of orthomolecular medicine. So orthomolecular medicine, as Dr. Constance was talking about in terms of allopathic and osteopathic, this is actually what we call comprehensive medicine. We look at how biochemical imbalances can actually affect mood, anxiety, depression, schizophrenia, ADHD. If there's a mental health issue involved, we know by way of our science and research and understanding that there are chemical imbalances that are typically at the root cause. Now, what does that mean? It means that if there's a root cause and you can find it, you can assess it, you can treat it without pharmaceutical medication. Now, in that realm, what we do is, just like traditional medicine, we listen very carefully to a patient's history. We take our time in listening. That is very, very key, to listen to what the people have got to say, family history included. And then after that, we have absolute testing processes that we do that are objective. So this is not about guesswork, it's not psychiatry. But after looking at these tests, we can now determine which chemical imbalances are related to the patient's condition. And then we design a nutrient-based protocol that targets the underlying conditions, corrects them, and promotes healing. Now, when I say promotes healing, what I mean is it treats the actual condition. The beauty of this process is that it's not called looking for a diagnosis that's traditional. Anxiety is a psychiatric disorder. It's not a physiologic condition. Now, forgive me, let me switch that around. By way of the technical term anxiety, what there are several different chemical imbalances that can each produce anxiety. So let me give you an example. Many of you know that fatty foods can cause you to feel depressed. But why is that? It's because of the nature of the fats themselves that, when taken in too large a volume, can actually cause neurotransmitter sequestration or imbalances. Now let's talk about something else. A chemical imbalance, such as a low level of zinc in the system, can lead to anxiety, depression, poor focus, poor wound healing, and a variety of other conditions. Now, what we call orthomolecular, other people call molecular or micromolecular medicine, because it's looking at the body and it's taking the body as a machine, that which it is, because you know we are spirits that operate a machine, and this machine can become dysregulated. So in what we do, we look at what's wrong with the machine and correct it using the right parts. So zinc, for example, if you are low in zinc, you cannot make your neurotransmitters. Zinc is necessary to produce serotonin, dopamine, and your calming neurotransmitter, known as gamma aminobutyric acid. So if you're low in zinc, you can't produce the very chemicals that cause you to be calm in the first place. And that results in anxiety. That's the same model or the same molecular approach to everything from ADHD to depression to anxiety to psychosis to autism, conditions that traditional medicine doesn't even recognize are orthomolecular nature or that are problematic from a curative perspective. When was the last time you ever heard anyone talk about actually curing autism or correcting autism to the point where people no longer carry the diagnosis? Well, if you're still looking through a traditional model eye lens, then that's all you're going to see, which is the same old thing, which is a lack of true treatment. And what's so important about this is that in the traditional sense, most people are not aware of orthomolecular medicine, and especially in the communities that are African American, African, brown, or non-white communities. We are very well often the communities that suffer the most because of this lack of knowledge. But here's the real irony. The leaders in the field are African American, African, brown, or black. So it becomes very key and very important that we understand that not only are we involved in the process, we are leaders in this field. We treat doctors, we teach doctors around the world how to do what it is that we do. But what most people really don't understand, and here's the number one message, there's hope out there for these conditions. There is not only hope, there is treatment. that treatment is not random, it is not guesswork, it is actually a structured pursuit of healing that is statistical in nature. There is no way, no how, that orthomolecular medicine does not know the why and cannot only not reproduce the condition in terms of treatment, but also consistently treat these conditions in several people. So it's not about guesswork. It is a new field of medicine that's actually a very old field of medicine. This was done 40 to 50 years ago by the original Carl Pfeiffer. Back in the old days when we talked about alchemy, alchemy was closer to real medicine than much of what we've got today. Much of what we have today is indeed driven by the pharmaceutical industry, or is indeed driven by the process of monetary gain, as opposed to true healing. True healing is correcting that which is the underlying piece. We started out that way in medicine. We started looking for what was causing the problem. But from a mental health perspective, as soon as we started hearing about bacteria and viruses that affect the body, we stepped away from looking for the underlying causes of mental health conditions and started using just drugs to treat. Well, that's so wrong, because drugs are basically trying to affect neurotransmitters in a way that is not natural. What we do is we look at what's producing the neurotransmitter in the first place, what's producing the excess capacity in this place, what's producing the deficiency in that place, and we correct the underlying cause. People, we don't even need to be that smart. Our bodies are far smarter than we will ever be. Give the system what it needs to correct itself, and then watch and see what happens.